And we're joined by Jacob and Jerry Johnson of Marble City Pharmacy. And Jacob, we were going to hit the sound roll for the birthday for Jared, but
well, I didn't feel like my opera quality pipes were up to snuff this morning, so we weren't going to sing happy birthday on set.
Well, happy birthday to you, sir.
Thank you very much.
63 and counting.
63. Feels great, though.
Well, let me know about that. This is Health Monday. We're going to do this the second Monday of every month. Since it's Jacob brought out, it is the second Monday of the month. We're doing this. Marble City Pharmacy sponsoring this, and it is cholesterol month, the month of September, and let's talk about that just a little bit. And Jared, exactly what does that mean?
Well, this is Cholesterol Education or Awareness Month. First of all, let's start with, I guess, what is cholesterol? Cholesterol kind of has a bad connotation, but believe it or not, cholesterol is something that our bodies actually need. Our bodies make it. It's produced in our liver. It helps us to make certain kinds of hormones and helps us to make vitamin D and other kinds of substances that kind of help us digest food. So that's kind of the good, right? But the bad is, as many of you know, cholesterol can lead to heart disease, heart attack, or stroke.
What's the difference in, Jacob, good cholesterol and bad cholesterol?
Well, good cholesterol helps transport things out of our bloodstream that we don't need. Bad cholesterol likes to set up in your blood vessels and kind of coat the sides and make them smaller and less pliable, which leads to higher blood pressure, higher risk of stroke. All the things that come with bad cholesterol side effects are from that bad cholesterol lining those arteries and clogging it up.
Who is susceptible to cholesterol issues?
Well, almost everybody, truth be told. But some things that we can't do anything about is how old we are, what sex we are, or gender, and then what we inherit from our parents. Jacob and I both have high cholesterol, and it's something that we've had from an early age in our life, maybe in our 20s.
It's Dad's fault.
As everything else is, we blame that on our parents, right?
Yeah.
And so those are things that we can't change. But then there are things that we can change, such as what we eat. Well, there are certain foods that are high in cholesterol, like chicken livers, for example. Certain things, foods that are high in saturated fats, like our fried foods. Basically, all the things we love to eat in the state of Alabama can lead to high cholesterol.
And high cholesterol Jacob, can be a real issue for folks.
Yeah, it's so common. You look at a map of the United States, the southeast United States is much more susceptible to this, again, because of our diet, like he mentioned. But yeah, we're talking, those cholesterols and those plaques building up in your blood vessels, you're going to get heart attacks and strokes and increased blood pressure and all sorts of other what we call coronary artery diseases that come with it. And they have so many impacts on every aspect of your life once you start down this road. So it's very important to stay on top of it before you ever get to that point.
I guess, as you mentioned, diet is a key here, but probably all kind of medication available to help with the cholesterol issue.
Well, sure. First of all, as we say just about for everything, eat a healthy diet, get a reasonable amount of exercise per week. Those things help just about any medical condition that there is. But most people with high cholesterol do end up on prescription medication, no matter how good their diet is or how much they exercise in a week. And so the most common family of medications for cholesterol is a family called the statins. You guys may have heard of some of these, your Lipitors and your Zocors and your Crestors and those kind of medications. Honestly, I'm just throwing a number out there. I'd say half the patients in our pharmacy over age 40 are probably on one of these medicines, maybe more. Maybe more than that. They're very, very effective medications at both lowering your bad cholesterol and helping to increase, at least by a marginal amount, your good cholesterol.
This is Health Monday. We do this every second Monday of each month, and Jacob and Jared join us every week from Marble City Pharmacy, and we talk about changing of the seasons, and temperatures certainly will get cooler soon, right?
I hope.
Yeah.
You're the weatherman.
But flu shots, and you hear people talking about, well, I've got the flu, or I've got a cold, I've got both, and I'm going to take a shot, or I'm not going to take a shot. This is a season for flu shots.
We have already started, and I can already say this. We have already seen actual flu here in Sylacauga, which that's rare. We usually haven't started by now. And it takes 2 weeks for the flu shot to become effective. So, okay, I'm looking right at the camera here. It's time to get your flu shot. We already have flu. It's time to get your flu shot to prevent it.
Now, you talk about a bad place to be. If you're diagnosed with the flu, you don't like nobody likes you most times.
Oh, sure. You're looking at probably a week or more of missed school or missed work. Nobody wants to be around you. Kind of like it'd be like living your life. But let me say this.
Mark that one around here. Okay.
Let me say this to add to what Jacob said. We're getting a lot of questions right now. Is it too early to get my flu shot? And it's not for a couple of reasons. Number one, what he said, we're already beginning to see the flu at earlier time than we have in most years in the past. But number two, there's been some concern over the last, let's say, 10 or so years that the flu shot may not last through the entire flu season. So flu season normally starts in October, runs through March, April, somewhere around that time. People think if they get their shot now, maybe it will wear off before the end of the flu season. Let me tell you something right now. That is not true. That is a myth. There was a time in the last 5 or so years where the CDC actually recommended that persons get a booster shot in the January or February because they were concerned that it wasn't lasting long enough. What we found out was that wasn't effective. People got the booster shot, still continued to get the flu. The issue is what strains of the flu are circulating that year. And if the match in the flu shot is just not the strains that are circulating in the air, it doesn't matter whether you've had the shot or not. And studies in recent years have found that the vaccine is effective for at least a year from when persons get it. So don't worry about the shot wearing off, guys. It's not too early to get it. The time is now.
All of us have heard this. I'm sure you guys have heard it more times than one, that y'all's opinion don't amount to very much. But no.
Correct, yes.
That's correct.
But
We've heard that a lot.
That's why we're quoting the CDC, guys. Yeah.
I'm not going to take the flu shot because it gave me the flu.
My turn or yours? I don't even remember.
It's your turn.
It's my turn. All right. It is physically impossible to get the flu from the flu shot. It is a deadened virus. What you can get from getting the flu shot is an immunization reaction. You can feel a little sick for a couple of days. I can assure you it's not the flu. One, because it's, again, physically impossible. Two, because the reaction you get from an immunization is drastically lessened than anything the flu would ever throw at you. And so, no one anywhere ever has gotten the flu from the flu shot.
Who needs to take the flu shot?
Well, anybody over age 6 months is the answer to that question. You used to have all these different age categories and different diseases and conditions that people might have and say, these are the people that really need a flu shot. Now the recommendation is everybody 6 months and older.
Can the flu shot be received at the store?
Absolutely. Now,
commercial time.
Yep.
Yeah, it's time for an advertisement.
By the way,
Everybody
your
come to
rate
Marble
goes
City
up,
Pharmacy,
right?
and we're paying more for this now.
That's right.
Now, we offer flu shots all day, every day. It doesn't require an appointment. Simply come in. Most insurers pay for the flu shot, not all, but most do. If you are Medicare, it's covered and it costs you exactly nothing. If you are Medicaid, it's covered, and I believe the copay this year is $1.30. Many commercial insurances choose to pay for it for their recipients. It also costs them nothing. At the most, it's $25. Worst case scenario, $25.
Jared, how do you, people's minds sometimes, they play tricks on us. They say, well, I remember taking that flu shot, or brother so-and-so took that flu shot, and it made them sick. And what causes a flu to begin with?
It's the same thing that causes a cold or any other infection. You happen to catch the virus. You might get it from the doorknob, or from if I borrow your pen, or I touch something that you've handled if you've had the flu. And then we touch our eyes or our nose or our mouth, which we're all inclined to do numerous times every single hour. And that's how it's transmitted.
Wow. This is Health Monday, and Jacob and Jared are here with us every second Monday of the month. Of course, the pharmacists over at Marble City Pharmacy. Now, I remember when you guys came to town, your dad was the star of the show, and I guess he still is, ain't he?
If you ask him,
Oh, yeah.
absolutely.
But Mom is the one who's really.
Mom runs the show, and we're scared of her. And we can
Understand.
freely admit that. We're not too old, even though Jared's 63 today.
Love you, Mom.
Yeah, we're not too old to admit that we're still scared of her.
Yeah. When someone has symptoms of the flu, what are some of those early symptoms?
Well, the flu has a lot of symptoms that are similar to a common cold, except which would be things like runny nose, nasal congestion, cough. But the biggest differentiation between the flu and the common cold is severe body aches, severe fatigue, right? If you've had the flu before, you know that you just don't want to get out of bed and you feel like somebody's beat you with a baseball bat. And so while a number of the things are similar to a common cold, you're talking about something that's much, much more severe. You simply can't get up and go to work even if you want to.
Now, this flu shot is, Jacob, is a preventive measure. I mean, we need to prevent getting the flu.
Yeah, you're treating nothing with the flu shot. It's not a treatment for anything. It is simply a prevention of the viruses that the CDC and their research has decided are going to be the circulating strains that year of this virus. This is the ones we're going to have. So we formulate that ahead of time into this flu shot. We take it, and if that's the strains that are actually out there, you will not become affected by them.
So I can just come in today.
Absolutely.
Get a flu shot?
I'd rather you not,
come
but
in.
other people
I
can.
understand.
Yes.
I understand. Yeah.
You can come in today, walk-ins, no appointments needed. And one of the things we'll do when you're in there is we'd like to use that kind of a time to look at your other vaccine history. You know, for example, there are certain persons who need the pneumococcal pneumonia vaccine.
Say what?
Yeah, I know it's
Longest
tough.
word he knows. Yeah, he's
Most
proud.
people call it the pneumonia shot, but it is the pneumococcal pneumonia vaccine. There are two different ones, and depending on your age and your health conditions, it might be time for you to have one. It's not something that's done every year. We'll look at people who might need the shingles vaccine or people who might need a tetanus or pertussis, you know. So we're going to look at your comprehensive vaccine history, if you'll allow us to, when you're in there and see what else it's time for.
And a lot of this is an educational process, which you guys are deeply involved in helping people educate themselves, for one thing, on the different type vaccination, that kind of things out there.
Oh, yeah.
There's a lot out there that it's tough even for us to remember off the top of our heads all the time. Okay, someone is, X age. They should have had this, they should have had this, they should have had this, they should have had this. So it does take someone really looking at that and saying, what have you had? When are you due for something else? Let's check against this. It really is a process, but it's important to do.
And I've been in there a number of times, and it's almost like a family. People come in and a lot of times they'll call you by your first name. You know them by their first names. You know their families. But when it comes to filling that doctor's prescription or making sure that they get the right information, there's no games there.
Well, there's no games there. We love to joke around, just like you said. Sometimes people call us by our first name. Some people call us a whole lot worse. But at the end of the day, we are healthcare professionals, and we want everybody to be treated like we would want to be treated. And so we take everybody's health condition seriously. We are proud of the fact that we do our best to know everything we can about their diseases, everything we can about their medication, and provide them with the very best information that we possibly can.
And we have a large population of older citizens. Talk to that older citizen group this morning about their healthcare needs.
Well, first of all, I'm going to let each individual decide what older means. And if anyone doesn't like the number, it's Jimmy Dell's fault.
No, you can talk to Jared.
It's clearly Jared's fault. Older people have different needs, clearly. We've already talked about it's very important to start getting what we're call some of those, older generation vaccines, the pneumonia and shingles, that aren't applicable to someone my age. And so those are very important. But health needs, you have higher risk of all of your chronic disease states, your high blood pressure, your high cholesterol, your diabetes, all those things you're at higher risk for as we age. And so those are very important. Then there are things, we got to protect your bones. We don't want you falling and breaking a hip. We got to, look at side effects of your medications. Are they more likely to make you fall, make you dizzy, less stable? So many things that go into taking care of the medical needs of an elderly person, that it does take a trained healthcare professional that not only is trained in that, but is willing to take the time and the purposeful act of doing that. We have to take care of those.
Jared, the pharmaceutical industry and this type of profession is ever changing. I don't see how you keep up with all the changes that are taking place in prescriptions and names and you got the generic this, generic that.
Sure. Well, the effort to keep up with everything that's going on is why his hair is gray and why mine is now non-existent. But yeah, things are changing, and not just with medications, disease states, but with the insurance industry. And if anything will make you pull your hair out, there's something right there. So it does take a great deal of time and effort, but we take a great deal of pride on staying up with everything that's going on so that we can best serve the people who are here.
All right. This is Health Monday, Marble City Pharmacy, and Jacob and Jared here with us every second Monday of the month. If they can't come, they'll send a facsimile, and we'll probably all be better served for that.
We will not send that.
We appreciate you guys being here this morning, and if people would like more information or their websites and stuff like that, they can go to?
Absolutely. www.marblecitypharmacy.com, or if you got a pen handy, 256-245-4446. Give us a call anytime.
All right, then get by and get that flu shot today at Marble City Pharmacy. Don't cost you anything. Just you just have to put up with these guys for a little while.
That's great. If you come today, bring a cake in honor of Jared's birthday.
Absolutely.
Right.
Absolutely.
Right. Now, do we sing here or wait?
No, we're going to wait for the singing. I don't sing until I see cake. That's my general belief.
He's a really good alto, though. Got a high voice.
Yeah. I'm with you on that one. Thank you both for being here this morning.
Okay, buddy.